Question 1. The control framework reveals that when presented with a dog exhibiting sudden, uncharacteristic aggression towards its owner, what is the most appropriate initial course of action for a licensed veterinary technician to recommend and implement? Option A. Suggest the owner confine the dog to a separate room until the aggression subsides, and then implement a strict, punishment-based training regimen. Option B. Recommend the owner ignore the aggressive behavior, assuming the dog is seeking attention, and focus on positive reinforcement for calm behavior. Option C. Advise the owner to immediately seek a veterinary examination to rule out underlying medical causes, while simultaneously observing the dog's body language and the environment for potential behavioral triggers. Option D. Immediately advise the owner to consult a certified animal behaviorist for advanced training techniques without first consulting a veterinarian. The correct answer is C. Advise the owner to immediately seek a veterinary examination to rule out underlying medical causes, while simultaneously observing the dog's body language and the environment for potential behavioral triggers. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to interpret subtle behavioral cues in a distressed animal and translate those observations into actionable advice for the owner. Misinterpreting these cues could lead to inappropriate handling, further stress for the animal, or a failure to identify underlying medical or environmental issues. The LVT must balance the animal's welfare with the owner's understanding and capacity to implement recommendations. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the animal's immediate welfare and safety through observation and a structured, evidence-based approach to behavior assessment. It aligns with the ethical responsibility of an LVT to advocate for animal well-being and to provide accurate, informed guidance. This approach respects the animal's species-specific instincts and learning capabilities, acknowledging that behavior is a complex interplay of these factors. It also adheres to the principle of providing client education that is practical and tailored to the situation, fostering a collaborative approach to animal care. Incorrect approaches analysis. An approach that immediately assumes a single cause without thorough observation, or considers only superficial training techniques, fails to acknowledge the complexity of animal behavior, potentially overlooking underlying medical conditions or significant environmental stressors. This could be considered a failure to meet the standard of care expected of an LVT, as it bypasses a critical diagnostic and assessment phase. Ethically, it could lead to the animal suffering unnecessarily if the true cause is not identified. An approach that dismisses the owner's concerns or provides generic advice without specific observation is professionally negligent. It fails to engage in effective client communication and education, which is a core responsibility of an LVT. This can erode client trust and lead to noncompliance, ultimately harming the animal. It also neglects the opportunity to gather crucial information from the owner's perspective. An approach that focuses solely on punishment-based methods without understanding the animal's behavioral motivations or the potential for negative side effects is ethically problematic and can be detrimental to the animal's welfare. Such methods can suppress behavior without addressing the root cause, increase fear and anxiety, and damage the human-animal bond. This contravenes the LVT's duty to promote humane treatment and positive reinforcement. Professional reasoning. Professionals should employ a systematic approach that begins with active listening and thorough observation. This involves gathering a detailed history from the owner, observing the animal's body language and interactions, and considering potential environmental, social, and medical factors contributing to the behavior. Based on this comprehensive assessment, the LVT can then formulate a plan that is tailored to the individual animal and owner, prioritizing humane and effective interventions, and providing clear, actionable advice. This process ensures that decisions are evidence-based, ethically sound, and focused on achieving the best possible outcome for the animal. Question 2. The audit findings indicate a recurring pattern of misinterpretations regarding the physiological basis of common canine diseases among the veterinary technician staff. Specifically, there is a notable lack of clarity on how cellular malfunctions contribute to observable symptoms. Which of the following approaches best addresses this fundamental knowledge gap to ensure compliance with veterinary technician practice standards? Option A. Prioritize the study of advanced genetic engineering techniques and their potential applications in veterinary medicine, as this represents the cutting edge of the field. Option B. Focus on memorizing the clinical signs and treatment protocols for the most prevalent animal diseases without delving into the underlying cellular mechanisms. Option C. Advise staff that a deep understanding of cellular biology is not essential for routine veterinary technician duties, and that practical experience is sufficient. Option D. Emphasize a thorough review of the primary functions of key cellular organelles, such as the nucleus, mitochondria, endoplasmic reticulum, and Golgi apparatus, and how their dysfunctions can manifest as pathological conditions in animal tissues. The correct answer is D. Emphasize a thorough review of the primary functions of key cellular organelles, such as the nucleus, mitochondria, endoplasmic reticulum, and Golgi apparatus, and how their dysfunctions can manifest as pathological conditions in animal tissues. Explanation: this scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to interpret and apply foundational biological knowledge within a regulatory context. The audit findings suggest a potential lapse in understanding or application of basic cellular principles, which could impact patient care, diagnostic accuracy, and adherence to established protocols. The LVT's role necessitates a thorough grasp of animal physiology at the cellular level to effectively assist in diagnosis, treatment, and client education. The correct approach represents best professional practice because it directly addresses the core issue identified by the audit: a misunderstanding of fundamental animal cell structure and function. By focusing on the organelles and their specific roles, e.g., mitochondria for energy production, nucleus for genetic material, the LVT can build a robust understanding that underpins all veterinary medical procedures. This aligns with the ethical obligation to provide competent care and the regulatory requirement to maintain professional knowledge. Understanding these basic building blocks is crucial for comprehending disease processes, drug mechanisms, and the overall health of an animal. An incorrect approach that focuses solely on external symptoms without understanding the underlying cellular pathology is professionally unacceptable. This represents a superficial understanding that could lead to misdiagnosis or ineffective treatment plans. Ethically, it fails to uphold the duty of care to the animal patient. From a regulatory standpoint, it demonstrates a lack of the foundational scientific knowledge expected of a licensed professional, potentially violating standards of practice. Another incorrect approach that prioritizes only the most complex cellular processes, such as advanced molecular signaling pathways, without a solid grasp of basic organelle function, is also problematic. While advanced knowledge is valuable, neglecting the fundamentals creates gaps in understanding. This can lead to an inability to troubleshoot common issues or to explain basic concepts to clients or colleagues. It suggests a potential for over-reliance on complex explanations without a firm grounding, which is not efficient or effective in a practical veterinary setting and may not meet the expected standard of care. Finally, an approach that dismisses the importance of cellular structure and function as being too theoretical for practical veterinary work is a significant professional failure. Veterinary medicine, at its core, is applied biology. Understanding how cells function is directly relevant to understanding how diseases manifest and how treatments work. Ignoring this foundational knowledge is akin to a builder ignoring the principles of physics. It leads to instability and potential failure in practice. This approach demonstrates a disregard for the scientific basis of veterinary medicine and is ethically and regulatorily unsound. The professional decision-making process for similar situations should involve a systematic review of audit findings, identifying the specific knowledge gaps. This should then be followed by a targeted effort to acquire or refresh the necessary knowledge, prioritizing foundational principles, seeking guidance from experienced colleagues or supervisors, utilizing accredited continuing education resources, and practicing the application of this knowledge in daily tasks are crucial steps. The ultimate goal is to ensure that all actions taken are informed by a comprehensive and accurate understanding of animal physiology, from the cellular level upwards, thereby upholding professional standards and ensuring optimal patient welfare. Question 3. Stakeholder feedback indicates a need to reinforce best practices in assessing and responding to complex patient presentations involving multiple organ system dysfunctions. A veterinarian has diagnosed a canine patient with concurrent renal insufficiency and early-stage congestive heart failure. The treatment plan includes a specific diuretic, a low-sodium diet, and an ACE inhibitor. During monitoring, the LVT observes a significant decrease in the patient's appetite and a slight increase in lethargy, which are not explicitly addressed in the current treatment orders. The LVT also reviews recent blood work showing a mild elevation in potassium levels. What is the most appropriate course of action for the licensed veterinary technician? Option A. Administer the prescribed medications and diet as ordered, and closely monitor the patient for any further changes. Documenting observations. Option B. Withhold the diuretic and ACE inhibitor due to the elevated potassium levels, and advise the owner to switch to a different diet, documenting these actions. Option C. Immediately contact the veterinarian to report the observed changes in appetite and lethargy, discuss the recent blood work findings, and seek clarification or modification of the treatment plan. Option D. Adjust the dosage of the diuretic based on the patient's lethargy and decreased appetite, assuming it is related to fluid overload, and document the adjustment. Correct answer is A. Administer the prescribed medications and diet as ordered, and closely monitor the patient for any further changes, documenting observations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to interpret and act upon potentially conflicting information from multiple sources regarding a patient's organ system function. The LVT must synthesize clinical signs, diagnostic results, and the veterinarian's directives to formulate a safe and effective treatment plan. Failure to accurately assess the patient's condition or follow veterinary instructions could lead to patient harm, professional disciplinary action, and erosion of client trust. The complexity arises from the interconnectedness of organ systems. Dysfunction in one can significantly impact others, necessitating a holistic understanding. Correct approach analysis. The correct approach involves a thorough assessment of the patient's presenting signs in the context of the diagnostic findings and the veterinarian's specific instructions. This demonstrates adherence to the Veterinary Practice Act and established professional standards of care. By prioritizing the veterinarian's orders and seeking clarification when necessary, the LVT acts within their scope of practice, ensuring patient safety and compliance with regulatory requirements. This approach reflects a commitment to evidence-based practice and ethical responsibility, where the patient's well-being is paramount. Incorrect approaches analysis. One incorrect approach involves independently altering the prescribed treatment based on a personal interpretation of the diagnostic results without consulting the veterinarian. This violates the LVT's scope of practice, which typically prohibits independent diagnosis or treatment modification. It could lead to inappropriate therapy, patient harm, and potential legal or regulatory repercussions, including charges of practicing veterinary medicine without a license. Another incorrect approach is to proceed with the treatment plan without fully understanding the rationale behind the veterinarian's orders or the implications of the diagnostic findings. This demonstrates a lack of critical thinking and a failure to uphold the standard of care. It could result in errors in administration, missed opportunities to identify worsening conditions, and ultimately compromise patient outcomes, potentially leading to disciplinary action for negligence. A third incorrect approach is to dismiss the diagnostic findings as irrelevant and solely rely on the initial clinical signs. This ignores crucial objective data that may indicate underlying or developing organ system dysfunction. It represents a failure to integrate all available information for a comprehensive patient assessment, which is a cornerstone of competent veterinary care and a regulatory expectation. Professional reasoning. Professionals should employ a systematic approach to patient care. This involves 1. Thoroughly reviewing all available information, including clinical signs, diagnostic results, and the veterinarian's orders. 2. Critically analyzing the information to identify any discrepancies or areas requiring clarification. 3. Prioritizing the veterinarian's directives while maintaining awareness of the patient's overall condition. 4. Communicating any concerns or seeking clarification from the veterinarian promptly and professionally. 5. Documenting all assessments, interventions, and communications accurately. This structured decision-making process ensures patient safety, regulatory compliance, and ethical practice. Question 4. Assessment of a veterinary technician's ability to accurately interpret and apply basic medical terminology, specifically focusing on the functional understanding of prefixes, root words, and suffixes, when presented with a new or complex term related to canine cardiology. Option A. Avoid using or questioning any unfamiliar medical terms encountered in patient records or discussions. Option B. Guess the meaning based on the sound of the word or its similarity to other, more familiar terms. Option C. Deconstruct the term into its prefix, root, and suffix to deduce its meaning, and if necessary, consult a veterinary medical dictionary for confirmation. Option D. Rely solely on memorizing a list of common veterinary terms without understanding their etymological components. Correct answer is C. Deconstruct the term into its prefix, root, and suffix to deduce its meaning, and if necessary, consult a veterinary medical dictionary for confirmation. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary medicine where accurate and efficient communication is paramount. Misinterpreting or misapplying medical terminology can lead to diagnostic errors, inappropriate treatment plans, and ultimately, compromised patient care. The professional challenge lies in the technician's responsibility to not only understand, but also correctly utilize this terminology in written and verbal communication with veterinarians, colleagues, and potentially clients, ensuring clarity and precision in all interactions. Correct approach analysis. The correct approach demonstrates a thorough understanding of the foundational elements of medical terminology. By correctly identifying the prefix, root, and suffix of a given term, the technician can decipher its meaning, even if unfamiliar with the specific condition. This analytical skill is crucial for accurate record keeping, effective communication during case discussions, and informed participation in treatment planning. It aligns with the ethical obligation to provide competent care and the regulatory requirement for accurate medical documentation, ensuring that all information conveyed is precise and unambiguous. Incorrect approaches analysis. One incorrect approach involves guessing the meaning based on a superficial resemblance to other words. This is a significant regulatory and ethical failure, as it introduces a high risk of misinterpretation. It bypasses the systematic analysis of word components, leading to potential inaccuracies in understanding diagnoses or procedure. This can result in incorrect medication dosages, inappropriate nursing interventions, or miscommunication of critical patient information, violating the duty of care and potentially leading to disciplinary action for negligence. Another incorrect approach is to rely solely on memorization without understanding the underlying structure of the terms. While memorization has its place, it is insufficient for true comprehension. Without understanding prefixes, roots, and suffixes, the technician will struggle with new or complex terms, limiting their ability to adapt and learn. This approach can lead to errors when encountering variations or combinations of terms, failing to meet the standard of competence expected of a licensed professional. It represents a failure to engage in continuous learning and critical thinking, which are implicit requirements for maintaining licensure. A third incorrect approach is to avoid using or questioning unfamiliar terms. This passive stance is a direct contravention of the professional's duty to ensure understanding and clarity. It creates communication barriers and can lead to critical information being overlooked or misunderstood. Ethically, it is a failure to advocate for patient safety by not seeking clarification. From a regulatory standpoint, it can be seen as a failure to maintain professional standards and contribute effectively to the veterinary healthcare team. Professional reasoning. Professionals should approach medical terminology by systematically breaking down unfamiliar words into their constituent parts, prefixes, word beginnings, root words, core meaning, and suffixes, word endings. This analytical method allows for the deduction of meaning and fosters a deeper, more adaptable understanding than rote memorization. When encountering a new term, the professional should first attempt this breakdown. If ambiguity remains, the next step is to consult reliable veterinary medical dictionaries or resources, or to seek clarification from a veterinarian. This process ensures accuracy, promotes effective communication, and upholds the highest standards of patient care, aligning with both ethical obligations and regulatory expectations for licensed professionals. Question 5. Comparative studies suggest that when discussing a diagnosis of a mass in the cranial aspect of the thoracic cavity, the most effective communication strategy for a pet owner involves Option A, stating that there is an abnormal cellular proliferation in the anterior thoracic region. Option B, explaining that the mass is located in the front part of the chest, near the head. Option C, informing the owner about the presence of a lesion in the cranial thorax without further anatomical clarification. Option D, describing the lesion as a neoplastic growth within the mediastinum. Correct answer is B, explaining that the mass is located in the front part of the chest, near the head. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to accurately interpret and communicate complex anatomical and pathological information to a client who may have limited understanding of veterinary terminology. Miscommunication can lead to client anxiety, misunderstanding of the animal's condition, and potentially noncompliance with treatment plans, all of which can negatively impact patient care. The LVT must balance the need for precise medical language with the client's comprehension level, demonstrating empathy and clear communication skills. Correct approach analysis. The correct approach involves using clear, concise language that accurately reflects the anatomical location and pathological process without resorting to overly technical jargon. This approach prioritizes client understanding and engagement, which is crucial for effective veterinary care. By translating complex terms into understandable concepts, the LVT empowers the client to make informed decisions about their pet's health and treatment. This aligns with ethical principles of client education and informed consent, as well as regulatory expectations for professional communication. Incorrect approach is analysis. Using overly technical or obscure anatomical and pathological terms without explanation creates a barrier to client understanding. This can lead to confusion, frustration, and a feeling of being excluded from the decision-making process. It fails to meet the ethical obligation to educate the client and can be seen as unprofessional communication. Using overly simplistic or inaccurate terminology can lead to a misunderstanding of the severity or nature of the animal's condition. This can result in inappropriate client expectations, delayed or incorrect treatment, and potential harm to the animal. It also undermines the professional credibility of the LVT and the veterinary practice. Focusing solely on the pathological process without referencing the anatomical location provides an incomplete picture. The client needs to understand where the problem is occurring in their pet's body to fully grasp the implications of the diagnosis and treatment. This incomplete communication hinders effective client participation in care. Professional reasoning. When faced with communicating a diagnosis involving anatomy and pathology, professionals should first assess the client's likely level of understanding. They should then translate technical terms into plain language, using analogies or visual aids if helpful. The focus should always be on ensuring the client comprehends the location, nature, and implications of the condition, as well as the proposed treatment plan. This involves active listening, checking for understanding, and providing opportunities for the client to ask questions. Adherence to professional communication standards and ethical guidelines for client education is paramount. Question 6. The risk matrix shows a potential for misidentification of internal anatomical structures during a routine diagnostic ultrasound of a rabbit presenting with abdominal discomfort. Given the known anatomical variations within lagomorphs and the potential for confusion with other common small mammals, what is the most appropriate approach for the licensed veterinary technician to ensure accurate identification and subsequent diagnostic interpretation? Option A. Assume the internal anatomy closely mirrors that of a domestic cat, as both are common companion animals, and proceed with interpretation based on feline anatomical references. Option B. Rely on the veterinarian's initial assessment of the rabbit's condition and interpret the ultrasound images based on general mammalian anatomy without specific rabbit references. Option C. Systematically palpate and visually inspect external anatomical landmarks, then consult a detailed, species-specific anatomical atlas for rabbits, cross-referencing ultrasound findings with typical organ positions and appearances. Option D. Delegate the primary interpretation of the ultrasound images to a veterinary student with prior exposure to small animal anatomy, trusting their general knowledge. The correct answer is C. Systematically palpate and visually inspect external anatomical landmarks, then consult a detailed, species-specific anatomical atlas for rabbits, cross-referencing ultrasound findings with typical organ positions and appearances. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in the comparative anatomy of domestic species, even within the same broad category like small mammals. A licensed veterinary technician, LVT, must accurately identify anatomical structures to perform diagnostic procedures and administer treatments. Misidentification can lead to incorrect diagnosis, inappropriate treatment, and potential patient harm, which directly impacts the quality of care and professional accountability. The challenge lies in applying generalized knowledge to specific, potentially atypical presentations. Correct approach analysis. The correct approach involves a systematic and detailed examination of the patient, cross-referencing observed anatomical features with established knowledge of the specific species and breed. This demonstrates best professional practice by prioritizing patient safety and accurate diagnosis. It aligns with the ethical obligation of an LVT to provide competent care and the regulatory requirement to act within the scope of practice, which includes accurate anatomical assessment for diagnostic and therapeutic purposes. This approach minimizes the risk of error by not relying on assumptions and instead on direct observation and verified knowledge. Incorrect approaches analysis. One incorrect approach is to assume anatomical similarity based solely on the broad classification of small mammal, without further species-specific verification. This fails to acknowledge the significant anatomical differences that exist even between common small mammals like rabbits and guinea pigs, let alone less common species. This can lead to misinterpretation of findings and inappropriate interventions, violating the duty of care. Another incorrect approach is to rely solely on a single, potentially outdated, anatomical reference, without considering the possibility of individual variation or congenital anomalies. While references are crucial, they represent typical anatomy. Failing to adapt to individual patient presentations can result in overlooking critical diagnostic information or administering treatments to the wrong anatomical location, posing a direct risk to the animal and a failure in professional diligence. A third incorrect approach is to delegate the definitive anatomical identification to a less experienced team member without direct supervision or verification. While teamwork is essential, the LVT has a professional responsibility for the accuracy of diagnostic information and treatment plans. Abdicating this responsibility without ensuring competency and oversight can lead to errors and compromises patient welfare, potentially violating regulatory standards regarding supervision and accountability. Professional reasoning. When faced with an unfamiliar or potentially atypical anatomical presentation, a professional LVT should employ a structured decision-making process. This begins with a thorough visual and physical examination of the patient, noting all observable characteristics. Next, consult reliable, species-specific anatomical resources, prioritizing current and reputable texts or databases. If uncertainty persists, seek guidance from a supervising veterinarian or a more experienced colleague, clearly articulating the observed findings and the specific anatomical question. Document all observations, consultations, and decisions meticulously. This systematic approach ensures that patient care is based on accurate information and minimizes the risk of harm. Question 7. To address the challenge of interpreting a veterinary medical record that contains a partially completed entry for a critical medication administration, which approach best ensures patient safety and regulatory compliance for a licensed veterinary technician? Option A. Immediately administer the medication as indicated by the partial entry, assuming the veterinarian intended for it to be given. Option B. Seek clarification from the supervising veterinarian regarding the incomplete entry and review any available diagnostic results before proceeding with administration. Option C. Proceed with a different, routine task for the patient while waiting for the veterinarian to potentially update the record later. Option D. Make an educated guess about the intended dosage and frequency based on similar past cases and administer the medication. The correct answer is A. Immediately administer the medication as indicated by the partial entry, assuming the veterinarian intended for it to be given. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a licensed veterinary technician, LVT, to interpret and act upon incomplete or potentially misleading information within a patient's medical record. The core difficulty lies in discerning the most critical information when faced with ambiguity, ensuring patient safety and continuity of care without overstepping professional boundaries or making assumptions. The LVT must balance the need for immediate action with the imperative to obtain accurate and complete data, all while adhering to established protocols and ethical standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and ethical responsibility by seeking clarification and additional information before proceeding with treatment. This aligns with the core tenets of veterinary medicine, which emphasize accurate diagnosis and treatment planning based on comprehensive data. Specifically, this approach upholds the LVT's duty to assist the veterinarian, ensuring that any actions taken are informed and appropriate. It also reflects a commitment to meticulous record-keeping and communication, which are fundamental to regulatory compliance and high-quality patient care. By consulting with the veterinarian and reviewing available diagnostic results, the LVT demonstrates a proactive and responsible approach to patient management, minimizing the risk of error and ensuring that treatment is tailored to the patient's actual needs. Incorrect approaches analysis. Proceeding with treatment based solely on the incomplete entry without seeking further information is a significant regulatory and ethical failure. It constitutes practicing veterinary medicine without a complete understanding of the patient's condition, potentially leading to inappropriate or harmful treatment. This bypasses the veterinarian's ultimate responsibility for diagnosis and treatment planning, and violates the LVT's obligation to work under veterinary supervision and to ensure accurate record-keeping. Making assumptions about the intended treatment based on the partial entry is also professionally unacceptable. This can lead to misinterpretation of the veterinarian's intent and the administration of incorrect medications or procedures. It demonstrates a lack of critical thinking and a failure to adhere to the principle of obtaining clear instructions, which is a cornerstone of safe veterinary practice and regulatory compliance. Ignoring the discrepancy and proceeding with a routine task unrelated to the patient's immediate care is a failure to recognize and address a potential patient welfare issue. While not directly causing harm in the immediate moment, it represents a dereliction of duty to ensure the patient receives appropriate care and that medical records are accurate and complete. This passive approach can delay necessary interventions and contribute to a breakdown in communication and patient management. Professional reasoning. When faced with ambiguous or incomplete medical records, a professional LVT should employ a systematic decision-making process. First, identify the discrepancy or missing information. Second, assess the potential impact of this ambiguity on patient safety and care. Third, consult the supervising veterinarian for clarification and guidance. Fourth, review all available diagnostic data and previous records to gather more context. Fifth, document all communications and actions taken. This process ensures that decisions are informed, ethical, and compliant with regulatory requirements, prioritizing the patient's well-being above all else. Question 8. The assessment process reveals that a licensed veterinary technician is tasked with performing venipuncture on a fractious cat and then immediately proceeding to obtain thoracic radiographs of a large, anxious dog. Which approach demonstrates the most appropriate application of restraint principles for these distinct procedures and patient types? Option A. Employing a specialized, padded restraint device for the fractious cat to facilitate safe venipuncture, and using a gentle, verbal encouragement and minimal physical contact approach for the anxious dog during radiography. Option B. Administering a mild sedative to the cat to allow for easy venipuncture, and relying solely on the owner's presence to calm the anxious dog during radiography. Option C. Using a muzzle and a towel wrap for the fractious cat to ensure immobility for venipuncture, and a strong, two-person manual hold for the anxious dog during radiography. Option D. Utilizing a consistent, firm manual restraint technique for both the cat and the dog, ensuring they remain immobile for the duration of each procedure. The correct answer is D. Utilizing a consistent, firm manual restraint technique for both the cat and the dog, ensuring they remain immobile for the duration of each procedure. Explanation. This scenario presents a common challenge in veterinary practice, adapting restraint techniques to the specific needs of a procedure and the individual patient. The professional challenge lies in balancing the need for patient safety and immobility with minimizing stress and potential injury to the animal, all while ensuring the procedure can be performed effectively and safely for the veterinary team. This requires a nuanced understanding of animal behavior, species-specific handling, and the requirements of different diagnostic and therapeutic interventions. The correct approach prioritizes patient welfare and procedural efficacy through a tailored restraint strategy. This aligns with the core ethical and regulatory principles of veterinary practice, which mandate providing competent and humane care. Specifically, it reflects the expectation that licensed veterinary technicians will utilize their knowledge to select the most appropriate and least stressful method for each situation, thereby minimizing patient anxiety and risk of injury. This proactive and individualized approach is a hallmark of best professional practice. Incorrect approaches fail to meet these standards. Employing a single, generalized restraint method for all procedures, regardless of patient species, temperament, or the specific demands of the task, demonstrates a lack of critical assessment and can lead to significant patient distress, potential injury, e.g., from struggling against an inappropriate hold, and compromised procedural outcomes. Such a failure to adapt restraint techniques can be seen as a breach of the duty of care owed to the animal and may contravene regulations that require technicians to act in the best interest of the patient. Furthermore, using a method that is overly aggressive or not suited to the procedure can increase the risk of injury to the veterinary team, which is also a consideration within professional practice guidelines. The professional decision-making process in such situations should involve a systematic evaluation. First, understanding the specific requirements of the procedure, e.g., stillness for radiography, access for venipuncture. Second, assessing the patient's species, breed, age, temperament, and any pre-existing conditions that might affect their tolerance to restraint. Third, considering the available restraint tools and techniques, and selecting the one that best balances immobility, safety, and patient comfort. Finally, continuously monitoring the patient's response during the procedure and being prepared to adjust the restraint method if necessary. Question 9. The assessment process reveals that a canine patient, exhibiting clear signs of fear and anxiety including panting, lip licking, and a tucked tail, is resisting a standard physical examination required for diagnostic purposes. The licensed veterinary technician, LVT, is tasked with assisting the veterinarian. Which of the following actions best upholds the regulatory framework and ethical guidelines for licensed veterinary technicians in this situation? Option A. Immediately restrain the dog firmly and proceed with the examination to ensure the veterinarian obtains the necessary information quickly. Option B. Inform the veterinarian that the dog is too fearful to examine and suggest postponing the procedure indefinitely. Option C. Gently attempt to redirect the dog's attention with positive reinforcement and utilize a calm, quiet approach to complete the examination, communicating any significant observations to the veterinarian. Option D. Administer a mild sedative to the dog without consulting the veterinarian to facilitate a quicker examination. Correct answer is C. Gently attempt to redirect the dog's attention with positive reinforcement and utilize a calm, quiet approach to complete the examination, communicating any significant observations to the veterinarian. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to balance immediate patient welfare with the need for accurate diagnostic information, all while adhering to established protocols and ethical guidelines. The LVT must recognize signs of stress and fear in a potentially fractious animal and implement appropriate handling techniques to prevent injury to both the animal and themselves, without compromising the veterinarian's diagnostic goals. This requires keen observation, quick decision-making, and effective communication. Correct approach analysis. The correct approach prioritizes minimizing stress and fear in the animal while ensuring safety. This aligns with the principles of animal welfare, which are often codified in veterinary practice acts and ethical guidelines. By employing low-stress handling techniques, the LVT demonstrates a commitment to the animal's well-being, which is a core ethical and professional responsibility. This approach also indirectly supports accurate diagnostics, as a less stressed animal is more likely to cooperate and exhibit more natural behaviors, reducing the risk of misinterpretation due to fear-induced responses. Regulatory frameworks for LVTs typically mandate humane treatment and safe handling practices. Incorrect approaches analysis. One incorrect approach involves proceeding with forceful restraint without attempting to de-escalate the animal's fear. This directly violates principles of humane animal handling and could lead to injury, exacerbating the animal's stress, and potentially leading to a negative outcome for the diagnostic procedure. Ethically, this demonstrates a disregard for animal welfare. Legally, it could be considered a failure to meet professional standards of care. Another incorrect approach is to abandon the diagnostic procedure entirely due to the animal's initial fear without exploring alternative, less stressful methods. While safety is paramount, a complete abandonment without attempting mitigation might be seen as a failure to adequately assist the veterinarian in achieving diagnostic goals, provided safe alternatives exist. This could be viewed as a lack of professional diligence in finding solutions within the scope of practice. A third incorrect approach might involve using excessive or inappropriate sedation without veterinary direction or a clear indication of necessity based on the animal's distress level. While sedation can be a tool, its indiscriminate use can mask underlying issues, complicate diagnostics, or pose its own risks. This would represent a failure to follow proper veterinary protocols and could be outside the LVT's scope of practice without direct veterinary authorization. Professional reasoning. When faced with a fearful or fractious animal during a diagnostic procedure, the LVT should first assess the animal's level of distress. The professional decision-making process involves 1. Prioritizing safety for all involved. 2. Employing low-stress handling techniques and environmental modifications to reduce fear and anxiety. 3. Communicating observations and concerns to the veterinarian. 4. Collaborating with the veterinarian to determine the most appropriate course of action, which may include alternative handling methods, environmental adjustments, or judicious use of sedation under veterinary direction. The goal is to achieve diagnostic accuracy while upholding the highest standards of animal welfare and professional conduct. Question 10. The monitoring system demonstrates a patient exhibiting piloerection, a tucked tail, and intermittent low growls and hisses. The patient is housed in an isolation ward. Which of the following is the most appropriate immediate next step for the veterinary technician? Option A. Continue monitoring without intervention, assuming the behavior is a normal response to isolation. Option B. Immediately attempt to physically restrain the patient to prevent potential aggression. Option C. Assess the patient for species-specific signs of distress and implement appropriate feline calming protocols if indicated. Option D. Assume the patient is a dog experiencing generalized anxiety and administer a mild sedative as per standard canine protocols. The correct answer is C. Assess the patient for species-specific signs of distress and implement appropriate feline calming protocols if indicated. Explanation. Scenario analysis. This scenario presents a professional challenge due to the subtle yet critical differences in feline and canine stress indicators. Misinterpreting these signals can lead to inappropriate handling, exacerbating patient anxiety, potentially causing injury to the animal or staff, and ultimately compromising the quality of care. The veterinary technician must possess a nuanced understanding of species-specific ethology to accurately assess the situation and intervene effectively. Correct approach analysis. The correct approach involves recognizing that the observed behaviors, while potentially indicative of discomfort in either species, are more characteristic of feline distress. Feline vocalizations, such as hissing and growling, coupled with piloerection and a tucked tail, are classic signs of fear and aggression in cats. Promptly implementing species-appropriate calming techniques, such as providing a quiet environment, using pheromone diffusers, and approaching with slow, non-threatening movements, aligns with best professional practice. This approach prioritizes patient welfare by minimizing stress and preventing escalation of the behavior, adhering to the ethical obligation to provide humane and compassionate care, as outlined in Veterinary Technician Practice Acts and Guidelines. Incorrect approaches analysis. One incorrect approach involves assuming the behavior is canine-specific and attempting to use canine-oriented calming methods. This fails to acknowledge the distinct behavioral repertoire of felines. Ethically, this demonstrates a lack of due diligence in species-specific assessment, potentially leading to ineffective or even counterproductive interventions. Regulatory frameworks for veterinary technicians emphasize competent care, which includes accurate species identification of behavioral cues. Another incorrect approach is to ignore the behavior, attributing it to general animal unease. This is a failure to recognize and respond to clear indicators of distress. Ethically, this constitutes neglect of patients' immediate welfare needs. From a regulatory standpoint, it represents a breach of the duty of care, as a licensed professional is expected to observe, interpret, and act upon patient signals. A third incorrect approach is to immediately resort to physical restraint without further assessment or attempts at environmental modification. A restraint may be necessary in some situations. Initiating it based on a misinterpretation of species-specific signals is premature and can significantly increase the animal's fear and stress. This violates the principle of minimizing patient distress and can be considered poor professional judgment, potentially leading to regulatory scrutiny for unprofessional conduct. Professional reasoning. Professionals should employ a systematic approach to behavioral assessment. This involves 1. Observation, carefully noting all observable behaviors, posture, vocalizations, and physical signs. 2. Species identification, determining the species of the animal exhibiting the behavior. 3. Comparative ethology, accessing knowledge of species-specific behavioral norms and stress indicators. 4. Intervention planning, selecting appropriate, least invasive interventions based on the species-specific assessment. 5. Reassessment, continuously monitoring the patient's response to interventions and adjusting the plan as needed. This structured process ensures that interventions are tailored to the individual animal's needs and species, upholding ethical and regulatory standards of care. Question 11. Consider a scenario where a licensed veterinary technician, LVT, is tasked with restraining a newly admitted canine patient for a physical examination. The dog is exhibiting signs of anxiety, including panting, lip-licking, and a tucked tail, and has no known history of aggression. The LVT must choose the most appropriate method for safe and effective handling. Option A. Administer a mild sedative to the dog before any physical contact is made, regardless of the dog's current level of cooperation. Option B. Immediately attempt to place a muzzle on the dog and proceed with a firm, assertive restraint to prevent any potential biting or struggling. Option C. Proceed with a quick, forceful restraint to get the examination done as efficiently as possible, assuming the dog will eventually comply. Option D. Approach the dog calmly, speak in a soft tone, allow the dog to sniff their hand, and use gentle, supportive restraint techniques, potentially with the assistance of another team member if needed, to minimize stress and ensure control. The correct answer is D. Approach the dog calmly, speak in a soft tone, allow the dog to sniff their hand, and use gentle, supportive restraint techniques, potentially with the assistance of another team member if needed, to minimize stress and ensure control. Explanation. This scenario presents a professional challenge due to the inherent risks associated with handling animals of different temperaments and species, requiring the licensed veterinary technician, LVT, to apply species-specific knowledge and safety protocols. The core of the challenge lies in balancing the need for effective restraint for veterinary procedures with the animal's welfare and the safety of all personnel involved. Regulatory frameworks for LVTs emphasize the importance of minimizing stress and injury to animals and ensuring a safe working environment. The correct approach represents best professional practice because it prioritizes a thorough assessment of the animal's behavior and species-specific needs before initiating handling. This aligns with the ethical obligation to provide compassionate care and adhere to established veterinary protocols designed to prevent harm. Specifically, it demonstrates an understanding of the nuances of animal behavior, recognizing that a calm, confident approach, coupled with appropriate equipment and assistance, is crucial for successful and safe handling. This proactive and informed strategy minimizes the likelihood of bites, scratches, or escape, thereby protecting both the animal and the veterinary team. An incorrect approach that involves rushing the process without adequate assessment or preparation is professionally unacceptable. This failure to observe and understand the animal's cues can lead to an escalation of fear or aggression, resulting in injury to the animal or personnel. Ethically, this demonstrates a lack of due diligence and a disregard for the animal's welfare. Regulatory failure occurs because it violates the implicit and explicit requirements for competent and safe practice, which are foundational to maintaining licensure. Another incorrect approach, such as relying solely on excessive force or sedation without considering less invasive methods, is also professionally unsound. While sedation might be necessary in some cases, its indiscriminate use without a proper risk-benefit analysis and consideration of alternative handling techniques can lead to complications and is not always the safest or most humane option. This approach fails to demonstrate the LVT's skill in behavioral assessment and adaptive handling strategies, potentially violating regulations that mandate the least stressful and harmful methods. The professional decision-making process for similar situations should involve a systematic evaluation. First, assess the animal's species, known temperament, and current behavior. Second, identify the specific veterinary procedure required and the level of restraint necessary. Third, determine the appropriate handling techniques, equipment, and personnel needed, prioritizing safety and welfare. Fourth, Communicate clearly with the veterinary team about the plan. Finally, continuously monitor the animal's response throughout the procedure and be prepared to adapt the handling strategy as needed. This iterative process ensures that decisions are informed, ethical, and compliant with regulatory standards. Question 12. The investigation demonstrates that a 14-year-old feline patient with a history of chronic kidney disease and mild dehydration is scheduled for a dental prophylaxis. The veterinarian has provided a standard anesthetic protocol for routine dental procedures. As the licensed veterinary technician responsible for preoperative preparation, you have reviewed the patient's record and noted the potential for increased anesthetic risk due to the patient's age and concurrent conditions. Which of the following actions best represents the optimal preoperative preparation and anesthetic management strategy? Option A. Independently adjust the dosages of the anesthetic agents in the provided protocol to account for the patient's age and kidney disease without consulting the veterinarian. Option B. Conduct a thorough preoperative assessment, including a detailed review of the patient's medical history, physical examination findings, and recent laboratory results, and then consult with the veterinarian to discuss any identified risks and propose potential modifications to the anesthetic protocol to better suit the patient's specific needs. Option C. Proceed with the standard anesthetic protocol as prescribed by the veterinarian, as it is the established procedure for dental prophylaxis. Option D. Inform the owner that the procedure cannot proceed due to the increased anesthetic risk and advise them to seek a second opinion from another veterinary practice. Correct answer is C. Proceed with the standard anesthetic protocol as prescribed by the veterinarian, as it is the established procedure for dental prophylaxis. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to balance immediate patient needs with established anesthetic protocols and the veterinarian's instructions. The patient's age and concurrent conditions introduce significant anesthetic risk, demanding meticulous preoperative assessment and potentially protocol adjustments. The LVT must exercise sound judgment to ensure patient safety without overstepping their scope of practice or deviating from veterinary direction without proper consultation. Correct approach analysis. The correct approach prioritizes a thorough preoperative assessment, including a detailed review of the patient's history, physical examination findings, and laboratory results. This comprehensive evaluation allows the LVT to identify any pre-existing conditions or risk factors that might influence anesthetic drug selection, dosage, or monitoring requirements. Based on this assessment, the LVT should consult with the veterinarian to discuss any concerns and propose modifications to the anesthetic protocol that are justified by the patient's specific condition. This collaborative approach ensures that the anesthetic plan is tailored to the individual patient, minimizing risks and adhering to best practices in veterinary anesthesia, which are often guided by professional standards and regulatory expectations for patient care. Incorrect approaches analysis. One incorrect approach involves proceeding with the pre-established anesthetic protocol without further assessment or consultation, despite identifying potential risks. This failure to adequately assess the patient's specific needs and consult with the veterinarian represents a breach of professional duty and potentially violates regulations that mandate appropriate patient care and veterinary oversight. It demonstrates a lack of critical thinking and a disregard for the increased anesthetic risk associated with the patient's age and concurrent conditions. Another incorrect approach would be to unilaterally alter the anesthetic protocol without consulting the veterinarian. While the LVT may have identified a need for adjustment, making such changes independently exceeds the LVT's scope of practice and bypasses the veterinarian's ultimate responsibility for patient care and anesthetic management. This action could lead to adverse drug interactions, inadequate pain management, or other complications, and is a direct violation of Veterinary Practice Acts and professional conduct guidelines. A third incorrect approach might be to delay the procedure due to perceived risks without a clear plan for risk mitigation or consultation. While caution is warranted, an LVT's role is to facilitate safe patient care, not to unilaterally halt procedures. The appropriate action is to identify risks, communicate them to the veterinarian, and collaborate on a solution, which may involve proceeding with a modified protocol, further diagnostics, or a revised surgical plan. Professional reasoning professionals should approach such situations by first adhering to the principle of do no harm. This involves a systematic process. 1. Thoroughly review all available patient information, history, physical exam, diagnostics. 2. Identify any deviations from normal or known risk factors. 3. Consult relevant professional guidelines and protocols. 4. Communicate any concerns or potential modifications clearly and concisely to the supervising veterinarian. 5. Collaborate with the veterinarian to develop and implement the safest and most appropriate anesthetic plan for the individual patient. This iterative process of assessment, communication, and collaboration ensures that patient welfare remains paramount and that all actions are within the scope of practice and regulatory requirements. Question 13. Upon reviewing the medical record of a canine patient diagnosed with a severe skin infection and concurrent osteoarthritis, the veterinarian has prescribed a course of antibiotics, a non-steroidal anti-inflammatory drug, NSAID, and an opioid analgesic. The veterinary technician is responsible for administering these medications as directed, which approach best ensures the patient's safety and therapeutic outcome. Option A. Administer all prescribed medications simultaneously as per the veterinarian's written orders, ensuring the patient is monitored for any immediate adverse reactions. Option B. Administer the antibiotics and opioid analgesic as prescribed, but withhold the NSAID due to concerns about potential gastrointestinal side effects in a debilitated patient, and inform the veterinarian later. Option C. Administer the antibiotics, NSAID, and opioid analgesic at the veterinarian's discretion, prioritizing the antibiotic administration first, followed by the analgesic, and then the NSAID, while closely observing the patient for any adverse effects. Option D. Administer the antibiotics, NSAID, and opioid analgesic in the order they are listed on the prescription, ensuring each dose is given at the correct interval. Correct answer is A. Administer all prescribed medications simultaneously as per the veterinarian's written orders, ensuring the patient is monitored for any immediate adverse reactions. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice. Managing a patient with a complex condition requiring multiple medications with potential for adverse interactions. The veterinary technician must exercise sound judgment in administering these drugs, considering not only their therapeutic effects, but also their pharmacokinetic and pharmacodynamic profiles, as well as potential contraindications and side effects. The challenge lies in ensuring patient safety and efficacy while adhering to veterinary medical protocols and ethical standards. Correct approach analysis. The correct approach involves a thorough understanding of each medication's properties and potential interactions. Administering the prescribed antibiotics, analgesics, and anti-inflammatories in a manner that minimizes adverse effects and maximizes therapeutic benefit is paramount. This includes considering the timing of administration, potential for synergistic or antagonistic effects, and monitoring the patient closely for any signs of adverse reactions. This approach aligns with the veterinary technician's role in assisting the veterinarian in patient care, ensuring accurate drug administration, and recognizing and reporting potential complications, all of which are fundamental to professional practice and patient welfare. Incorrect approach is analysis. Administering all medications simultaneously without considering potential interactions or the patient's specific condition is a failure to exercise professional judgment. This could lead to unpredictable drug interactions, potentiated side effects, or reduced efficacy of one or more medications, directly compromising patient safety and violating the ethical duty of care. Administering only the antibiotics and analgesics while withholding the anti-inflammatory due to a perceived risk without consulting the veterinarian is an overreach of the veterinary technician's scope of practice. While recognizing potential risks is important, unilaterally altering a prescribed treatment plan without veterinary direction constitutes a deviation from established protocols and can lead to undertreatment of the patient's condition, potentially causing further harm. Administering the medications in a random order without regard for their properties or the patient's condition demonstrates a lack of understanding of pharmacology and patient management. This haphazard approach increases the likelihood of adverse drug events and is a direct failure to provide competent care, which is a cornerstone of professional veterinary practice. Professional reasoning. Professionals should approach such situations by first reviewing the complete patient record and the veterinarian's treatment plan. They should then consult reliable veterinary pharmacology resources to understand the properties, indications, contraindications, and potential interactions of all prescribed medications. If any concerns arise regarding the safety or efficacy of the prescribed regimen, the technician should communicate these concerns to the veterinarian for clarification or modification of the plan. Continuous patient monitoring for efficacy and adverse effects is also a critical component of professional decision-making. Question 14. Quality control measures reveal inconsistencies in the use of abbreviations within patient medical records. A veterinary technician is observed using RX to denote a prescription, DX for diagnosis, and TX for treatment. While these are commonly understood in some contexts, the practice's internal policy mandates the use of a standardized list of approved abbreviations to ensure clarity and compliance. Which of the following approaches best upholds professional standards and regulatory requirements for veterinary record keeping? Option A. Replace all abbreviations with full written terms to eliminate any potential for misinterpretation, regardless of time constraints. Option B. Allow individual technicians to use abbreviations they are familiar with, provided they can explain them if questioned. Option C. Continue using RX, DX, and TX as they are widely recognized and expedite documentation. Option D. Implement a mandatory practice-wide training session on the approved abbreviation list and enforce its consistent use for all medical record entries. The correct answer is C. Continue using RX, DX, and TX as they are widely recognized and expedite documentation. Explanation. Scenario analysis. This scenario presents a challenge in maintaining accurate and efficient communication within a veterinary practice. Misinterpreting or misusing common veterinary abbreviations can lead to critical errors in patient records, treatment plans, and client communication, potentially impacting patient safety and the practice's legal standing. The pressure to document quickly can exacerbate the risk of using non-standard or ambiguous abbreviations. Correct approach analysis. The correct approach emphasizes the importance of adhering to established, approved abbreviations within the practice's protocols and regulatory guidelines. This ensures clarity, consistency, and accuracy in medical records, which is a fundamental requirement for patient care and legal compliance. Using a standardized list of abbreviations, as mandated by veterinary practice acts and professional guidelines, minimizes the risk of misinterpretation and supports effective team communication. This aligns with the ethical obligation to provide competent care and maintain accurate records, as often stipulated by veterinary licensing boards. Incorrect approaches analysis. Using an abbreviation that is not officially recognized or is ambiguous creates a significant risk of miscommunication. This can lead to incorrect dosages, treatments, or diagnostic interpretations, violating the duty of care owed to the patient. Such practice could be considered a breach of professional standards and potentially fall short of the record-keeping requirements outlined by veterinary regulatory bodies. Employing abbreviations that are specific to a particular specialty or institution, without ensuring all team members understand them, can lead to exclusion and errors. This lack of universal understanding hinders effective team collaboration and can result in patient care being compromised if a team member misinterprets the information. It reflects a failure in ensuring clear and accessible communication for all involved in patient care. Relying solely on personal shorthand or newly created abbreviations, even if understood by the individual, is a direct contravention of best practices for medical record keeping. This practice introduces a high degree of subjectivity and is highly prone to misinterpretation by other veterinary professionals, auditors, or during legal proceedings. It undermines the integrity and reliability of the patient's medical history and is a clear deviation from regulatory expectations for standardized documentation. Professional reasoning. Professionals should approach the use of abbreviations by first consulting the practice's approved list, which should be based on recognized veterinary medical terminology and guidelines. When in doubt, it is always best practice to write out the full term. Regular training and reinforcement of correct abbreviation usage among all staff are crucial. This systematic approach ensures that communication is clear, accurate, and legally defensible, prioritizing patient safety and professional integrity. Question 15. Examination of the data shows a veterinarian instructs a licensed veterinary technician to dispense a controlled substance medication for a patient without providing a specific prescription for that instance, relying on a general understanding of the patient's ongoing needs. The technician is aware that controlled substances require strict dispensing protocols. Option A. The technician should dispense the medication as instructed, assuming the veterinarian's general instruction is sufficient for ongoing patient care. Option B. The technician should refuse to dispense the medication and inform the veterinarian that they cannot fulfill the request. Option C. The technician should dispense the medication only after receiving a specific written prescription for the controlled substance for that particular patient and dispensing event from the veterinarian. Option D. The technician should dispense the medication based on the veterinarian's verbal instruction, documenting the verbal order in the patient's record. The correct answer is A. The technician should dispense the medication as instructed, assuming the veterinarian's general instruction is sufficient for ongoing patient care. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice, where a veterinary technician is asked to perform a task that falls outside their defined scope of practice and potentially involves a controlled substance. The challenge lies in balancing the veterinarian's request with the legal and ethical obligations of the technician, ensuring patient safety, and maintaining professional integrity. The technician must navigate the specific regulations governing veterinary practice and pharmacology within their jurisdiction. Correct approach analysis. The correct approach prioritizes adherence to the established regulatory framework for licensed veterinary technicians. This involves understanding the scope of practice, which typically prohibits independent prescription or dispensing of controlled substances. The technician's responsibility is to communicate their limitations and seek clarification or direct supervision from the veterinarian. This upholds the legal boundaries of their role, ensures proper oversight of controlled substances, and protects both the patient and the veterinary practice from regulatory violations. It demonstrates professional accountability and a commitment to ethical practice by not exceeding authorized capabilities. Incorrect approaches analysis. One incorrect approach involves proceeding with dispensing the controlled substance without explicit, direct instruction and supervision from the veterinarian for each specific instance. This is a direct violation of regulations governing controlled substances, which require strict record-keeping and dispensing authority vested in the veterinarian. It also oversteps the technician's scope of practice, potentially leading to diversion, misuse, or administration errors, all of which have serious legal and ethical ramifications. Another incorrect approach is to dispense the medication based on a standing order or a general instruction from the veterinarian without specific authorization for that particular patient and prescription. This bypasses the veterinarian's direct oversight for each controlled substance transaction, which is a critical component of controlled substance regulations and veterinary pharmacology laws. It creates a risk of unauthorized dispensing and undermines the veterinarian's ultimate responsibility for patient care and medication management. A third incorrect approach is to refuse to dispense the medication without offering any alternative or seeking clarification from the veterinarian. While caution is warranted, a complete refusal without professional communication can hinder patient care and create an adversarial relationship. The ethical and legal expectation is for the technician to engage in professional dialogue to find a compliant solution, rather than simply refusing a task that might be achievable under proper supervision. Professional reasoning. When faced with such a situation, a licensed veterinary technician should employ a decision-making process that begins with identifying the request and comparing it against their understanding of their scope of practice and relevant regulations. If there is any doubt or if the request appears to fall outside their authorized duties, the next step is to seek clarification from the supervising veterinarian. This communication should be clear, concise, and professional, outlining the technician's concerns regarding the specific task and its potential regulatory implications. The technician should be prepared to suggest compliant alternatives or request specific, direct instructions and supervision to ensure the task is performed legally and ethically, always prioritizing patient safety and regulatory adherence. Question 16. Performance analysis shows that post-operative surgical patients require vigilant monitoring for potential complications. A licensed veterinary technician observes a canine patient 12 hours after an abdominal exploratory surgery, exhibiting increased restlessness, a slight increase in heart rate, and a small amount of serosanguinous discharge from the incision site. What is the most appropriate immediate course of action for the LVT? Option A. Document the observations in the patient's record and continue routine monitoring. Option B. Increase the patient's intravenous fluid rate to improve circulation and tissue perfusion. Option C. Immediately notify the supervising veterinarian of the observations and await further instructions. Option D. Administer a prescribed analgesic and monitor the patient for improvement. Correct answer is C. Immediately notify the supervising veterinarian of the observations and await further instructions. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary surgical patient management, recognizing and responding to potential post-operative complications. The LVT's role is to provide vigilant monitoring and timely intervention, which requires a thorough understanding of expected recovery versus signs of distress. The professional challenge lies in differentiating between normal post-operative discomfort and a developing complication, necessitating prompt and accurate assessment to ensure patient welfare and adhere to professional standards of care. Correct approach analysis. The correct approach involves immediate and thorough assessment of the patient's vital signs, surgical site, and overall demeanor, followed by prompt communication with the supervising veterinarian. This aligns with the core responsibilities of a licensed veterinary technician, LVT, as defined by Veterinary Practice Acts and professional guidelines. The LVT is expected to observe, report, and assist in managing patient care, which includes recognizing deviations from the norm and escalating concerns to the veterinarian. This proactive monitoring and communication are essential for early detection of complications like hemorrhage, infection, or anesthetic reactions, thereby optimizing patient outcomes and fulfilling ethical obligations to provide competent care. Incorrect approaches analysis. One incorrect approach involves delaying reporting the observed changes to the veterinarian, perhaps due to uncertainty or a belief that the changes might resolve on their own. This failure to act promptly constitutes a breach of professional duty and could lead to the exacerbation of a serious complication, potentially resulting in patient harm. Ethically, this demonstrates a lack of diligence and commitment to patient welfare. Regulatory frameworks typically mandate that LVTs report significant findings to the supervising veterinarian. Another incorrect approach is to administer medications or treatments without explicit veterinary direction. LVTs operate under veterinary supervision, and administering treatments without authorization is a violation of Practice Acts and professional boundaries. This action bypasses the veterinarian's diagnostic and treatment planning role, potentially masking symptoms, causing adverse drug interactions, or delaying appropriate veterinary intervention. This is a clear regulatory and ethical failure. A third incorrect approach might be to focus solely on comfort measures without investigating the underlying cause of the patient's distress. While comfort is important, it should not supersede the identification and management of potentially life-threatening complications. This approach fails to address the root problem and could lead to a misdiagnosis and delayed treatment, again compromising patient welfare and violating professional standards. Professional reasoning. Professionals should approach post-operative patient monitoring with a systematic process. This includes establishing baseline parameters, understanding expected recovery trajectories for specific procedures, and maintaining continuous observation. When deviations occur, the professional should perform a focused assessment, gather objective data, vital signs, physical findings, and then communicate these findings clearly and concisely to the supervising veterinarian. This collaborative approach ensures that the patient receives timely and appropriate veterinary care, minimizing risks and maximizing the chances of a successful recovery. Adherence to established protocols and a commitment to ongoing learning about potential complications are also crucial. Question 17. The monitoring system demonstrates a consistent reading of 70/40 mmHg in a sedated canine patient undergoing a surgical procedure. The LVT is tasked with reporting this finding to the supervising veterinarian. Which of the following terms most accurately and professionally describes this finding? Option A, hypotension. Option B, low blood pressure. Option C, the monitor is showing a low reading. Option D, slightly low reading. The correct answer is A, hypotension. Explanation. This scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to accurately interpret and communicate complex medical information under pressure, ensuring patient safety and owner understanding. The challenge lies in translating objective data from a monitoring system into precise, actionable veterinary medical terminology that reflects the patient's physiological status. Misinterpretation or imprecise language can lead to delayed or incorrect treatment, potentially harming the patient and violating professional standards of care. The correct approach represents best professional practice because it prioritizes accurate and specific veterinary medical terminology. Using terms like hypotension accurately describes a critically low blood pressure, prompting immediate and appropriate intervention. This aligns with the LVT's ethical and regulatory responsibility to provide competent care, maintain accurate records, and communicate effectively with the veterinary team and clients. Adherence to precise terminology ensures that all parties understand the severity and nature of the patient's condition, facilitating timely and effective treatment decisions. An incorrect approach that uses vague or colloquial terms like low blood pressure is professionally unacceptable. While understandable to a layperson, it lacks the specificity required in a veterinary medical context. This imprecision can lead to underestimation of the severity of the condition, potentially delaying critical interventions. It may also indicate a lack of understanding of core veterinary medical terminology, which is a fundamental requirement for LVT licensure. Another incorrect approach that misinterprets the data, for example, by describing the reading as slightly low when it is critically low, represents a failure in observation and interpretation. This directly compromises patient safety and violates the LVT's duty of care. Such an error could stem from a lack of familiarity with normal physiological ranges or an inability to recognize critical values, both of which are serious professional deficiencies. A further incorrect approach that focuses on the equipment rather than the patient's condition, such as stating, "The monitor is showing a low reading," deflects responsibility and fails to convey the clinical significance of the data. The LVT's role is to interpret the data in the context of the patient's health, not merely report the raw output of a device. This approach demonstrates a lack of critical thinking and an inability to translate objective data into meaningful clinical information. Professionals should employ a decision-making framework that involves 1. Objective data acquisition and verification, confirming the monitoring system's accuracy. 2. Accurate interpretation of data using precise veterinary medical terminology, referencing established physiological parameters. 3. Clear and concise communication of findings to the veterinarian, using appropriate terminology. 4. Understanding the clinical implications of the findings and anticipating necessary interventions. 5. Continuous learning and self-assessment to maintain proficiency in medical terminology and diagnostic interpretation. Question 18. Analysis of a canine patient recovering from an exploratory laparotomy and spay, approximately 2 hours post-anesthesia, presents a critical juncture for monitoring. The veterinary technician is tasked with ensuring a safe and comfortable recovery. Which of the following approaches best aligns with professional standards and regulatory expectations for post-operative care and monitoring in this jurisdiction? Option A. Focus primarily on the surgical incision to check for any immediate signs of bleeding or dehiscence, assuming other systems are stable if the incision appears clean. Option B. Observe the patient from a distance to ensure they are not exhibiting obvious signs of distress, such as vocalization or struggling to stand. Option C. Conduct a thorough physical examination, including assessment of vital signs, pain level, surgical site integrity, and hydration status, documenting all findings and communicating any concerns to the veterinarian. Option D. Administer a prescribed analgesic based on the technician's judgment of the patient's pain level, without direct veterinary confirmation for this specific post-operative period. The correct answer is C. Conduct a thorough physical examination, including assessment of vital signs, pain level, surgical site integrity, and hydration status, documenting all findings and communicating any concerns to the veterinarian. Explanation: scenario analysis. This scenario presents a common yet critical challenge in veterinary practice, managing a patient recovering from anesthesia and surgery. The complexity arises from the inherent risks associated with the immediate post-operative period, including pain, potential for complications like hemorrhage or infection, and the patient's altered physiological state. The veterinary technician's role is paramount in recognizing subtle changes that could indicate a developing problem, requiring prompt intervention and communication with the veterinarian. Failure to monitor effectively can lead to delayed diagnosis of complications, increased patient suffering, and potentially adverse outcomes. Correct approach analysis. The correct approach emphasizes a systematic and thorough postoperative assessment, prioritizing vital signs, pain assessment, and surgical site integrity. This aligns with the core responsibilities of a licensed veterinary technician as defined by regulatory bodies, which mandate providing skilled nursing care and monitoring under veterinary supervision. Specifically, it reflects the ethical obligation to advocate for patient welfare and adhere to established protocols for safe recovery. This comprehensive approach ensures that potential issues are identified early, allowing for timely veterinary intervention and minimizing the risk of complications. It demonstrates a commitment to evidence-based practice and patient safety, which are cornerstones of professional veterinary nursing. Incorrect approaches analysis. One incorrect approach involves relying solely on the patient appearing comfortable without objective data. This is a failure of due diligence and a potential violation of professional standards. Regulatory frameworks often require objective assessment and documentation, not subjective impressions alone. Ethically, it prioritizes convenience over patient well-being, potentially overlooking early signs of distress or pain. Another incorrect approach is to focus only on the surgical incision and neglect other vital parameters. Postoperative complications can manifest in various ways, affecting cardiovascular, respiratory, or neurological systems. A limited assessment risks missing systemic issues that could be life-threatening. This demonstrates a lack of comprehensive understanding of anesthetic recovery and surgical patient management, which is a deficiency in professional competency. A third incorrect approach, such as administering pain medication without a veterinarian's specific order for the postoperative period, is a direct violation of Veterinary Practice Acts. Licensed veterinary technicians operate under veterinary supervision and cannot independently prescribe or administer medications outside of established protocols or direct orders. This constitutes practicing veterinary medicine without a license and is a serious regulatory and ethical breach. Professional reasoning. Professionals should employ a structured decision-making framework that begins with understanding the patient's specific surgical procedure and anesthetic protocol. This is followed by a systematic head-to-tail physical examination with a particular focus on vital signs, temperature, pulse, respiration, blood pressure, mucous membrane color, capillary refill time, pain assessment using validated scales, and meticulous examination of the surgical site for swelling, discharge, or bleeding. Crucially, this assessment must be documented accurately and communicated promptly to the veterinarian if any abnormalities are detected. This framework ensures that all critical aspects of postoperative care are addressed, promoting patient safety and optimal recovery. Question 19. Quality control measures reveal that a routine hematology panel for a canine patient shows a significantly lower packed cell volume (PCV) and total protein (TP) than anticipated based on the patient's clinical presentation and previous records. What is the most appropriate initial course of action for the licensed veterinary technician to take? Option A. Review the patient's signalment, clinical signs, and previous laboratory results for any potential explanations, and then meticulously re-examine the sample collection, handling, and preparation steps for any deviations from standard operating procedures. Option B. Contact the external reference laboratory to inquire about potential issues with their instrumentation or reagents, assuming the in-house results are erroneous. Option C. Report the low PCV and TP to the veterinarian as definitive findings and suggest immediate fluid therapy based on these results. Option D. Immediately rerun the sample on the same analyzer after verifying the analyzer's calibration logs and reagent expiration dates. The correct answer is D. Immediately rerun the sample on the same analyzer after verifying the analyzer's calibration logs and reagent expiration dates. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary diagnostics where a discrepancy arises between expected and actual laboratory results. The professional challenge lies in accurately identifying the source of the error, which could stem from pre-analytical, analytical, or post-analytical phases. A failure to properly investigate and resolve such discrepancies can lead to misdiagnosis, inappropriate treatment, and compromised patient welfare, all of which have significant ethical and regulatory implications for a licensed veterinary technician, LVT. The pressure to provide timely results must be balanced with the imperative for accuracy and reliability. Correct approach analysis. The correct approach involves a systematic, multifaceted investigation that begins with reviewing the entire workflow. This includes verifying patient identification, sample collection technique, sample handling and storage, reagent quality, instrument calibration and maintenance logs, and the technician's own procedural adherence. This comprehensive review aligns with best professional practice by ensuring that all potential sources of error are considered. Regulatory frameworks for veterinary practice, such as those overseen by veterinary medical boards, mandate that LVTs perform diagnostic procedures competently and ethically. This systematic approach demonstrates a commitment to quality assurance, patient safety, and adherence to established laboratory protocols, which are often implicitly or explicitly required by these regulations. It upholds the LVT's responsibility to provide accurate data for veterinary decision-making. Incorrect approaches analysis. One incorrect approach is to immediately assume the instrument is faulty without a thorough review of other variables. This bypasses critical pre-analytical and procedural checks, potentially leading to unnecessary instrument downtime, costly recalibration, and a failure to identify simpler, more common errors like improper sample preparation or labeling. This could be considered a breach of professional duty if it leads to delayed or incorrect diagnoses due to overlooking obvious procedural flaws. Another incorrect approach is to dismiss the discrepancy as a minor anomaly without further investigation, especially if the results are only slightly outside the expected range. This disregards the potential for subtle but significant underlying issues that could impact patient care. Ethically, LVTs have a duty to ensure the reliability of diagnostic data, and ignoring potential errors, even minor ones, compromises this duty and could violate regulations requiring diligent practice. A third incorrect approach is to solely rely on external laboratory confirmation without first attempting internal troubleshooting. While external confirmation is valuable, it is a post-analytical step. Failing to conduct internal quality control and procedural checks first can be inefficient and may not address the root cause if the issue is within the clinic's own processes. This can also be seen as a failure to exercise due diligence and may contravene guidelines that emphasize internal quality management. Professional reasoning. When faced with unexpected laboratory results, a professional LVT should employ a structured problem-solving approach. This begins with a thorough review of the entire diagnostic process, from sample acquisition to result reporting. The technician should consult standard operating procedures, SOP, instrument manuals, and quality control logs. If the initial review does not reveal an obvious error, a systematic troubleshooting process should be initiated, addressing pre-analytical factors, analytical factors, including instrument calibration and reagent checks, and post-analytical factors. Documenting all steps taken and findings is crucial. Collaboration with the supervising veterinarian is essential for interpreting results and deciding on further actions, such as repeating the test, performing additional diagnostics, or seeking external consultation. This methodical approach ensures accountability, promotes continuous quality improvement, and upholds the highest standards of patient care and professional integrity. Question 20. Cost-benefit analysis shows that addressing a dog's persistent digging in the yard by understanding its instinctual drive for burrowing and implementing species-appropriate enrichment activities, alongside owner education on redirecting this behavior, is more effective and humane in the long term than simply punishing the dog or ignoring the behavior. Considering this, what is the most appropriate course of action for a licensed veterinary technician when presented with this scenario by a client? Option A. Educate the owner on the dog's instinctual need to dig. Suggest alternative outlets for this behavior such as a designated digging pit, and recommend environmental enrichment to reduce boredom, while collaborating with the veterinarian on a comprehensive behavioral plan. Option B. Inform the owner that digging is a normal dog behavior and there is little that can be done about it, suggesting they accept it. Option C. Recommend immediate and consistent punishment for any digging observed in the yard to quickly deter the behavior. Option D. Advise the owner to administer an over-the-counter calming supplement to the dog before outdoor access to reduce its urge to dig. The correct answer is A. Educate the owner on the dog's instinctual need to dig. Suggest alternative outlets for this behavior such as a designated digging pit, and recommend environmental enrichment to reduce boredom, while collaborating with the veterinarian on a comprehensive behavioral plan. Explanation: this scenario is professionally challenging because it requires the licensed veterinary technician, LVT, to interpret subtle behavioral cues and apply knowledge of animal instincts and learning to ensure patient welfare and client compliance, all within the scope of practice and regulatory guidelines. The LVT must balance the immediate needs of the animal with the owner's understanding and ability to implement care. The correct approach represents best professional practice because it prioritizes the animal's well-being by addressing the root cause of the behavior through understanding instinctual drives and learned responses. This aligns with the ethical obligation to provide compassionate and competent care, as well as the regulatory framework that expects LVTs to contribute to a comprehensive treatment plan that includes behavioral management. By educating the owner and suggesting species-appropriate enrichment, the LVT is acting as an advocate for the animal and empowering the owner with knowledge, fostering a collaborative approach to care. This proactive and educational strategy is more effective and humane than simply suppressing the behavior. An incorrect approach that focuses solely on immediate suppression of the behavior without understanding its origin fails to address the underlying issue. This could lead to the behavior manifesting in other, potentially more problematic ways, or causing the animal undue stress and anxiety. Ethically, this is a failure to provide comprehensive care and can be seen as neglecting the animal's psychological well-being. From a regulatory standpoint, it may fall short of the expected standard of care if it leads to a deterioration of the animal's condition or a failure to achieve treatment goals. Another incorrect approach that involves recommending over-the-counter sedatives without a veterinary diagnosis or prescription is a significant regulatory and ethical violation. This constitutes practicing veterinary medicine without a license, which is strictly prohibited. It bypasses the veterinarian's role in diagnosis and treatment planning and could lead to serious adverse drug reactions or mask underlying medical conditions. A third incorrect approach that dismisses the owner's concerns as simply bad training without further investigation ignores the complex interplay of instinct, learning, and environmental factors that influence animal behavior. This can damage the client-veterinarian-technician relationship and prevent effective problem-solving. Ethically, it demonstrates a lack of empathy and a failure to engage in a collaborative approach to patient care. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and gather information about the behavior, noting context, triggers, and frequency. 2. Consider the animal's species-specific instincts and typical learning patterns. 3. Assess the environment and potential stressors or enrichment deficits. 4. Consult with the veterinarian to discuss findings and potential underlying medical causes. 5. Develop a behavior modification plan in collaboration with the veterinarian, focusing on positive reinforcement and addressing the root cause, while educating the owner on implementation and realistic expectations. 6. Document all observations, consultations, and recommendations.